His Majesty King Bhumibol Adulyadej was involved in the field of medicine and public health since birth. His father, Prince Mahidol, was named Thailand's father of modern medicine, and his mother was a nursing graduate. Therefore, it was in His Majesty's royal blood to help people. As a result of His Majesty's travels throughout the country, he was among the first to understand the public health challenge posed by tuberculosis. In 1951, His Majesty helped catalyse the production of the BCG vaccine against tuberculosis in Thailand by supporting the establishment of the BCG vaccine production department at the Queen Sawapa Memorial Institute at the Thai Red Cross Society. His Majesty personally donated his own funds to construct a BCG vaccine production building, which was named Mahidol Wongsanuson to honour the Mahidol family. Thanks to His Majesty's efforts and the country's close technical collaboration with WHO, BCG vaccine manufactured by Queen Sawapa Memorial Institute became the first registered biological product produced in Thailand. In the early 1950s, a wave of polio, a virus that can cause paralysis and death, swept across Thailand. Although the polio vaccine was developed and licensed in 1955, it was not yet available in Thailand. At that time, King Bhumibol contributed his own financial resources to fight the epidemic. A response to polio was launched, including fully equipped hospital wards for managing cases and the equipment for long-term rehabilitation for those most affected by the disease. Beginning in 1982, polio vaccine was made available to all Thai children as part of their routine immunization program. Together with King Bhumibol's vision of expanding health facilities to peripheral level, the vaccine was successfully introduced to children throughout the country. There has been no transmission of polio in Thailand since 1997. The spirit behind the royal support for leprosy in Thailand is exemplified by the name of the foundation established in 1960 for the disease, Ratchapracha Samasai, meaning mutual support between the king and the people. His Majesty personally allocated money for constructing and equipping the institution, which supports the prevention and control of leprosy, provides treatment and rehabilitation services, which include skills development, and conducts scientific research. There is no doubt that the royal support for leprosy helped enormously, both in attracting additional financial support from patrons, as well as in substantially changing the perceptions of people towards the disease itself, and towards those who personally battle leprosy's consequences. In the 1980s, iodine deficiency resulting in goiter was responsible for physical and mental retardation of thousands of children in the north and northeastern parts of Thailand. After learning about this problem, His Majesty instructed relevant agencies to identify natural sources of iodized salt and ordered the distribution of iodized salt to the needy populations. His Majesty's efforts contributed to a steady decline in goiter rates in Thailand.
His Majesty was hugely respected and will always be remembered for his dedication and commitment to the health and well-being of the people of Thailand. The numerous public health programs and foundations that His Majesty initiated over the years have contributed immensely to Thailand's social and economic development. Today, as low and middle income countries across the world strive to achieve the Sustainable Development Goals, which emphasize the importance of public health for wider development, His Majesty's example will be an inspiration within the Southeast Asia region and beyond.
In recognition of His Majesty's leadership, the International Council for Control of Iodine Deficiency Disorders, ICIDD, presented him with the ICIDD Gold Medal on the 25th of June, 1997. Recognizing that tobacco is one of the leading causes of disease and death for people globally, His Majesty established various institutes to tackle issues on tobacco control, including the Medical Association of Thailand, the Anti-Tuberculosis Association, and the Thai Cancer Society. Today, Thailand is a world leader in developing legislation and policy for tobacco control. On World No Tobacco Day in the year 2000, His Majesty King Bhumibol Adulyadej was presented with the WHO Director General's Prize in recognition of his unstinting and powerful moral leadership and example in public health for having provided the setting and the cultural atmosphere for Asia's strongest anti-tobacco action.
His Majesty's royal initiatives and personal engagement reflected his far-sighted vision of public health. He clearly understood that better health for all Thais was more than just a worthy goal in and of itself. It was key to the economic and social prosperity of the nation. By addressing the most pressing public health concerns of his time, His Majesty was and will continue to be an important role model both in Thailand and around the world.